At Growing Bolder, we are definitely the glass half full kids. We choose to look at aging through a prism of passion and possibility and not simply loss and limitation. We know that more is possible than our ageist culture would lead us to believe, but we also know that there are no guarantees. Bad things can and do happen to good people. We tell stories all the time of ordinary people who are living extraordinary lives, women and men who are surfing and writing, uh, writing books, riding bicycles, running companies, volunteering, traveling, starting new relationships, and more into their 90s. It is possible, it is achievable, but it is still the exception. So while we choose to celebrate extra years, we can't ignore that the reality for many is not something to celebrate. In fact, it is easy to go to a dark place very, very quickly if you only look at the numbers. If you look at the age wave itself and those who are now in it. So here are a few of those numbers. 10,000 Americans are now turning 65 every day, and 70% will likely need long-term care. There is, in fact, an onslaught of frail and fragile elderly that is coming at us day after day after day. And that's exacerbated by the fact that 37% have no retirement savings at all, while the costs for care are soaring, causing millions to die broke without the necessary care. Meanwhile, the number of available nursing home beds is rapidly dwindling. Nursing homes are experiencing unprecedented staff shortages, and there's a widening care gap, more elderly parents needing care, and fewer adult children to provide it. And for those who are caregivers, they're struggling now more than ever in ways that are jeopardizing their own health. And if it sounds like we are headed to some sort of dystopian future, it's because we could be. We have reached what many are now calling crisis mode, where the cost and the effort of caring for older Americans has become unsustainable. Is there a solution? Well, some say it could be a program called PACE, an acronym for Programs of All-Inclusive Care. And Shawn Bloom is the CEO of the nonprofit National PACE Association, and we've invited him to bring us up to speed on PACE. Shawn, how you doing today?
Doing very well, and thank you very much for the opportunity to join you today.
You know, I love this conversation. People think at Growing Bolder we want to ignore the reality of our mortality, but very much the opposite. I'll almost always feel like I have to offer a disclaimer that there is this other side that we need to talk about. You know, there can't be a stigma against talking about the challenges of aging. And before we help you or you help us understand PACE, tell me this, Shawn, did I go to too dark of a place? Are we currently in the beginnings of what you think could be or is a senior care crisis?
Yeah, as a matter of fact, it's interesting. I think the way you described it is probably more accurate than about anybody I've ever heard discuss this topic. We often refer to it as there's kind of a cliff ahead of us here. When you look at the demographics alone, then you factor in the likelihood of individuals needing care and the income status of the growing cohort of people that will need that care, and the lack of, I think, financing resources around these individuals to pay for the care. We're really looking at some really tough times moving forward.
You know, you and I should be a tag team as we go out and speak. You know, it is interesting. We had a Growing Bolder Day here in Central Florida recently. The Senior Resource Alliance came to me and said, "Will you support our Senior Day?" And I said, "No." And they said, "Wait a minute, you've always helped us." And I said, "I'll help you any way I can. But I believe, given the resources that Growing Bolder has, that every senior care organization should, to some extent, be trying to modify the lifestyle of younger adults so that we can try to get some sort of handle on this age wave of frail and fragile elderly that are coming toward us." That's where I like to talk about. You're talking about dealing with the folks that are in that age wave. And I think both sides of the equation are critically important. So other than an acronym, what is PACE? How long have you guys been around and what are you doing?
Yeah, we are in many ways, and we don't really wear this with pride, but I think we're probably one of the best kept secrets in aging care. We've been around, believe it or not, since probably the late 80s and early 90s. We originated
Wow.
in San Francisco. as a solution for a group of individuals in Chinatown that really wanted to find a more common sense approach to take care of their loved ones outside of a nursing home. So over the years, PACE was kind of tested, experimented, studied, and then finally in 1997, Congress added this as a permanent Medicare benefit and an optional Medicaid state plan service option. So we are, when individuals enroll in PACE, we are kind of care made simple. We organize and deliver all needed primary, acute, and long-term care services. And what really changes the nature of how we go about addressing individuals' care needs is how we get paid. We don't bill for every little thing we do. We get one lump sum per month. And with that money, we need to really get thoughtful about how best to meet individuals' needs. And that approach really has led to, we've got about 70,000 people today across the country that are receiving services from PACE, and only about 5% are permanently placed in a nursing home. So we've got a very good 20-year track record of delivering very good care, very high satisfaction, and extraordinary support for caregivers of individuals we serve.
If I'm understanding it, Shawn, it seems like it may be the ultimate win-win, because it sounds like you are providing the kind of care, and I mean all of the care that one might get in a nursing home, but for most of the people you serve, you are providing that care in their own home. Is that right?
Yeah, and most of our services are organized in the PACE Center. It's also important to note that we're not just here to help individuals stay out of their nursing home. We manage all their pharmaceutical needs. We manage all their primary care. We have to be thoughtful about everything because we are at financial risk for hospital services and essentially all Medicare and medically necessary services. So it is in our best interest to be incentivized to make sure individuals' health needs are addressed proactively, completely, and consistently over time so that they don't end up in a hospital and don't end up in a nursing home when we can just address those up front.
Is this an example of what's called value-based care as opposed to fee-for-service?
Yes, that is probably a little bit more accessible term. I think it's technically we are paid under capitation, which is a lump sum, but value-based care. And I think your point about, we call it aligned incentives. In PACE, the delivery of good care equates to good outcomes, both for the PACE organization, for the individual we serve, and for the government, because we save money. So it's really a win-win-win.
You've been around, like you said, since the 80s, but talk a little bit about the pandemic, if you will, and how it might have, impacted not just the services you provide, but the population's desire for those services, because it seems like the pandemic was a major turning point in the senior care industry. Fair to say many nursing homes did not fare well during the pandemic. Many people don't want to go to nursing homes now. There's fewer beds than there used to be. And as we said in the introduction, there's not a lot of people that want to work in nursing homes. What is the status of that industry right now? And how has that impacted what PACE does?
Yeah, very, very good question. Leading up to the pandemic, I think as a society, in particular, federal and state governments, they were becoming much more effective at what we refer to as rebalancing the system, which is essentially giving people more non-institutional or nursing home options to choose from. And so, but that was moving rather slowly, and I don't think it was keeping pace with what consumers really were wanting and demanding, kind of under the give me what I want to buy, not what you have to sell banner. But the pandemic, unfortunately, I think cast a very significant light on the need to support the emergence of new community-based options. And we're not talking about the traditional ones that have always been there, like home care and other things, but really models of care like PACE, which really consider the full spectrum of individuals' needs in the home, in the community. Again, primary care, nursing home care if needed, hospital care if we need to do that, and really looking at the whole person. But I think due to a change of consumer attitudes, a lot of incentives by the federal government for states to really support the emergence of new options, we are growing very, very significantly now.
So Who is PACE for? I mean, how many people are eligible for PACE benefits? I know you told us how many people you serve, but I'm guessing that's just a small percentage of those who might be eligible. And why aren't more people taking advantage of PACE services?
Yeah, no, very good question again. I think in our estimates, we're serving roughly 1% of people that could qualify and be eligible and benefit from PACE. The system has really been set up, I think, to allow individuals to choose either health plans or what I call institutional services, or maybe some home and community-based services. It's really not set up well, I think, to encourage people to enroll in comprehensive coordinated care models like PACE. That's changing. We're beginning to see that. It's also important to note that I mentioned that we are an optional Medicaid benefit. So we truly exist at the pleasure of the states, not only whether we exist at all, but how big our programs can grow. Now, having said that, some states, Florida, California, I could go on, have done a very good job really supporting the expansion and availability of PACE. But we still have a handful of states that have not offered PACE, so it's not available to individuals that can benefit from it.
So how can that be changed? Because I'm guessing people that are listening to us right now that think, wow, PACE sounds good for me. I mean, the individual is not going to change it. Will it take some sort of legislation? Is there anything in the works?
Yeah, I think one of the most important things that we're doing is we're constantly encouraging states to move forward. And in many states, that does require the passage of legislation. But I think more importantly, and probably more effectively, I think individuals, consumers need to really kind of speak to their elected officials about, I want some options like PACE in my market, in my community. And I think it's going to be the consumer voices that really help to propel PACE and expand its access throughout the country.
And I did read this, getting ready to speak with you. Folks, if you want a recommendation about PACE, here's a pretty good one. 97.5% of all caregivers recommend PACE. I mean, the folks that are in the industry understand that it does well. So if I understand this, Shawn, PACE programs help people address their healthcare needs, whatever they might be, while for the most part staying at their home instead of a nursing care facility. And PACE programs, in addition to helping people in their homes, they're based in communities that also have PACE community centers or PACE centers. What's that about? What's that like?
Yeah, and it's probably important in answering that question to begin with. In the middle of the PACE program is what's called an interdisciplinary team. An interdisciplinary team can be thought of and is defined by regulations, but we directly employ physicians, nurses, social workers, physical therapists, occupational therapists, home care professionals, transportation professionals, dietitians, essentially the full range of the type of individuals that provide the services that older adults often need when they grow older. They are directly employed. They meet every day in the PACE Center, and they perform a few functions. One, they do a comprehensive assessment of individuals' needs that's unique to each individual. They put together care plans that are specific to the needs of each individual. And then they monitor and track the delivery of those services to see how people respond. That's all within the day center, but there's also areas of the day center for recreation, nutrition, physical therapy. There's medical clinic. In many PACE centers, there's a pharmacy. So it's really the hub of really the PACE model of care that extends out into the community, into individuals' homes.
Sounds so much better than an understaffed nursing home, that doesn't have those things that we're learning, older adults need. I mean, we all need some sort of autonomy. We all need some sort of purpose. And so you mentioned 72,000 people now being served by PACE, give or take, but, more than 2 million people in the U.S. are eligible. And folks, people in the PACE program have no co-pays and no deductibles, as I understand it. Is that true, Shawn?
Yeah, if an individual chooses to elect in PACE, they will pay an out-of-pocket fixed amount each month, and that does not change based on their evolving needs. Again, and what that does, that may sound a little counterintuitive to people that are used to writing a check for every discrete service they use, but what it says to us is we've got very strong incentives to really be proactive in identifying and addressing individuals' existing and emerging healthcare needs in a manner which can mitigate or altogether eliminate the need for nursing home care and hospital use. So
It's
the model works well.
no, and it's easy for you and me to put a positive spin on this because I think we both believe in it. But you're the guy that's kind of at the down and dirty level of making this work. Honestly, from your perspective, Shawn, is this an answer to what is a care crisis? Could PACE be part of the solution moving forward?
Yes. I mean, I will say I grew up working in nursing homes as a nurse aide. I went to kind of undergraduate and graduate school to study aging. My family's been involved in long-term care for years. And I thoroughly and honestly believe that this is the gold standard of care for America's seniors. And the outcomes prove it. The research demonstrates it. And I think if you talk to, most importantly, the people that are supported by PACE and their caregivers, very high rates of satisfaction.
Well, that's a great endorsement, folks. We talk about empowering people with information, empowering people, to continue to extract joy out of their life, no matter what their current condition is. We don't pretend that everybody either can or would want to run a marathon or do something like that, but everybody wants to be able to enjoy their life. They like to extract themselves and their families from the stress of growing older, the care that's necessary. And PACE empowers older adults, as well as people with disabilities, to live at home, to remain in their communities, despite being eligible for nursing home care. So Shawn, tell us what people need to do. I mean, how can the people that are listening, help PACE grow and come to their state, or how can they find out if it's in their state, and how can they find out if they're eligible? What do we do?
Yeah. Well, let me, to be eligible for PACE, you have to be determined by the state. Each state has their own criteria to be eligible for a nursing home level of care. And that's typically some intersection between some cognitive issues and functioning, mobility, and medical issues. But I would check with each state to determine your eligibility. You have to be 55 years of age and older. And you have to live within the PACE service area, which is typically about 30 to 60 minutes drive time around the PACE center. One way to find out if PACE is in your community would be to go to our website, which is www.npaonline.org. And there's a PACE finder. You can type in your zip code and find if there's a program nearby. That's certainly one way. And while you're there, I would definitely encourage consumers also to look at, before I found PACE, which is a video category or video series that we did where we taped the experiences of older adults and their families and what their experience has been in PACE. So that would be a way to kind of find PACE. I would definitely, if it's not in your community, I would talk to your state or elected officials and ask why not.
I think that's a great point. We have found that there is nothing that moves people more than the example of others like them. And, it's good to hear that you've actually got testimonials, if you will, from people who have actually benefited from PACE programs. So, folks, PACE is helping people meet all of their care needs while staying in their home instead of a nursing home or a caring facility. And we're talking about comprehensive medical care, social services. Shawn mentioned a physical site in the community that can provide adult day care services. Shawn, this is the breath of fresh air, if you will, that I've needed when I do go to a dark place and I do look at these numbers of people that it's very easy to imagine a scenario in another 20 or 30 years where we are literally warehousing older adults who have very little quality of life. And it seems like PACE allows people to continue to have a quality of life as they age and as they encounter health problems.
Right. Yeah. And one thing I would like to leave the audience as kind of an example of our philosophy is we actually, the individuals we serve in PACE, we refer to as participants. And we say that because basically their preferences on how they want to age and grow older and receive care are really dictated by them and their families. So it is a model of care that definitely wraps itself around individuals, as opposed to the current system largely, where individuals have to fit in the defined set of services that are out there. It's a wonderful model of care, and I think for anybody that has an interest in growing old and having their preferences front and center and how they are served and cared for, PACE is really a good model for them.
Well, God bless you. Kudos to you and your team for creating, in the midst of this age wave, a model of care that does provide, a sense of autonomy while taking care of older adults, because that is difficult to find these days. Shawn Bloom, thank you so much for your time. Thank you for all you're doing. And folks, check it out. That's PACE, PACE, and see if perhaps they've got services that can help you or your loved ones continue to enjoy their life as they grow older.